Hi there, I'm going to be talking about sleep in babies and children. Now, sleep is almost always an issue in families with young kids. Every family is different, with different expectations and different abilities to cope with the sleep deprivation that really comes with parenthood. Don't expect miracles before 6 months of age. The young baby is programmed to require night feeds, which can be normal until 8 or 9 months of age. Thereafter, demanding a milk feed is usually not a nutritional issue, but rather a comfort or a prop to help them fall asleep again. Teaching a child to self-soothe is an important tool to impart on your young one and can be done from about 4 months of age, when the baby's brain becomes mature enough to learn new patterns. They may need a comforter, such as a special little blanket, soft toy, or dummy, or a combination of these to help them fall asleep. Whatever it takes, teaching a child to self-settle with gentle support requires a lot of patience, but is certainly worthwhile in the long run. In younger children, sleep is imperative for optimal growth and development. In older children and teenagers, sleep is of utmost importance to maintain optimal performance in the classroom and on the sports field. In fact, in a keynote address by the American Academy of Sleep Medicine, they commented that we've rushed headlong into this 24/7 world and we simply aren't adapted to deal with it. In this 24/7 world, we need to make sure that our basic needs are met, including our sleep requirements. So what can we expect to be within normal limits for sleep? Newborn babies are generally reasonably easy in the first 7 to 10 days, and after that they may become more difficult as the brain literally wakes up and colic and wind set in. Their sleep requirements are high, so about 16 to 18 hours a day in total for the first few weeks of life, gradually settling into a pattern of about 3 naps per day by 3 months of age. If possible, some naps should be more than 40 to 45 minutes long, which is the duration of a sleep cycle, in order to provide restoring sleep. At night time, young babies continue to wake 3 to 4 hourly for the first few weeks, but by 3 months of age, there is normally a longer stretch of sleep in the night of 5 or 6 hours. The total sleep requirement varies over time, and to promote optimal health, the American Academy of Sleep Medicine has very recently issued these recommendations of sleep requirements per 24-hour period. So total sleep requirement per day. In a newborn baby, as mentioned, is 16 to 18 hours per day, which includes 3 or 4 naps. In the 4 to 12-month-old, 12 to 16 hours a day of sleep, including 2 to 3 naps a day. In 1 to 2-year-olds, 11 to 14 hours a day, including 1 or 2 naps. And in 3 to 5-year-olds, 10 to 13 hours a day, usually with no daytime naps. In 6 to 12-year-olds, 9 to 12 hours, and in teenagers, 8 to 10 hours of sleep per 24-hour cycle. A normal sleep cycle is 35 to 45 minutes, and ideally a more restorative sleep spans more than one sleep cycle. As mentioned, night feeds are normal until about 9 months of age, and after that they become a luxury or a prop. However, in some babies, frequent nighttime feeds may need to be prolonged, for example in ex-prems or in ill babies who need night feeds to maintain their weight gain. So when do we need to worry about sleep? First of all, if there's a sudden change in sleep pattern, rather have the child seen. It may be anxiety, it may be illness. Secondly, if the child doesn't seem to be getting enough sleep and it's having repercussions on their behavior or development, rather seek help. And thirdly, if parents feel they are just not coping with the interrupted night's sleep that they're getting, rather seek help. Under such circumstances, it is worth having the child looked at to make sure there's not a physical ailment disrupting the sleep. The routine and feeding pattern of the child should be examined to make sure the daytime sleep and feed requirements are being met. Sleep training should be discussed. There are a variety of different forms of sleep training, ranging from controlled checking to gentle, gradual separation techniques. Please discuss these with your clinic sister or doctor before embarking on them. If a child is unwell, if a child is very young, under 6 months, or if the child is going through a stage of separation anxiety, it is not a good time to sleep train. Remember that this too shall pass, and most children, even the worst sleepers, usually sleep well by school-going age. Let's talk a little bit about sleep safety. The safety of our precious newborn babies and infants is actually our top priority when it comes to sleeping. The American Academy of Pediatrics has published extensive recommendations for a safe infant sleeping environment to minimize the risk of injuries and cot deaths. These recommendations include the following. First of all, babies should be put on their backs to sleep for every sleep. Tummy and side sleeping are not as safe. Car seats and sitting devices are not for routine or prolonged sleeps. Babies should preferably share a room with their parents for the first 6 months in their own cots without bed sharing. Parents should avoid tobacco smoke, illicit drugs, and excessive alcohol, especially in situations where there is co-sleeping. Babies should be breastfed if possible. It has a protective effect. And babies should definitely undergo their routine childhood immunizations. Using a pacifier or a dummy at sleep time has been found to be protective as well. Babies should sleep on a firm crib mattress with a fitted sheet, keeping soft objects such as loose blankets, bedding, soft pillows, and bumpers out of the cot for the first year. Avoid overheating. Infants should be sufficiently clothed to be warm, but not overheated. Generally, a young infant needs about 1 more layer than an adult to maintain a comfortable temperature. Do not cover the baby's head. Remember that the safest sleep position for your baby is on the back. The Back to Sleep campaign in the UK has seen the rate of cot deaths halve over only a few years, so this is advice well worth following. So that wraps up our talk focusing on sleep requirements and sleep safety. Sleep is a vast topic and a highly emotive one, so for further information and advice, please consult your healthcare practitioner.